Today we're here to announce our, we call it our We Care program. It's our outreach to 2 buildings here in Columbia, this being one of them, where we are bringing services to the community, meeting them where they are so that they can lead healthier and happier lives and do the things that they want to do.
Our Howard County Health Department conducted a needs assessment survey for residents who frequently reached out to 911 and identified common obstacles to care. The assessment revealed a need for health literacy, better nutrition and healthy eating programming, and resources for managing chronic conditions. And that's why today we are launching the We Care initiative. This innovative initiative stands for well-being education by community advocates right in your environment. We Care will provide programming with the Health Department and the Department of Community Resources and Services at our Cradle Rock locations to improve resident health in these identified needs. This innovative initiative will provide classes on living with chronic conditions, managing pain, and improving nutrition.
So when we became aware of data that was telling us that in specific locations within Howard County, there were a number of our residents calling 911, obviously a great need. I think there's very few people who want to have to call 911. It's usually because you think you're really sick and you need something that you can't help yourself with. But when 911 arrived, frequently the residents calling didn't need to go to the hospital. So that told us something, that there must be a gap. People feel that need, that I'm going to call these services that we have in Howard County, but when the professionals arrived, they didn't necessarily need to go to the emergency department. So obviously there's something else that they need, and we figure it's these things called the social determinants, or the empowerment of their health and wellness.
The We Care Hotspot Initiative aims to help residents access the services they need right here at home. Through greater access to social resources and healthcare that meet their needs, this program will help residents live longer, healthier, and happier lives with their loved ones. The initiative also addresses the service gap within our community through the development and delivery of person and patient-centered approaches, which will improve access to existing health resources and services and improve community health outcomes right here in Owen Brown.
What is the role of Howard County General Hospital in this? Well, we're doing this in a lot of ways already with our community care teams. And we have something called the Member Care Support Network that will work with you in this local community, with your care ambassadors, and we're going to train them. That's something that we do very well. We will train the people in your local community to care for you more effectively. We'll help you assess their needs, connect with each person and identify what our community resources are, and we will activate them to modify that you have local behavior to meet your best in health initiatives. Each one of the care ambassadors will receive patient engagement training, because it's not just knowing it, it's how to connect with people on a very personal level. And then they will have the opportunity to spend time shadowing our community care teams, those people that the hospital already funds to go out and deal with our most vulnerable. And these are people who have typically been utilizing hospital resources. So it's not everybody in the community. It's people that are continually utilizing hospital resources. This care will be broader than that and get people who obviously utilize healthcare resources, maybe not hospital resources, but we know in this community are most vulnerable and need help and support, because there are cultural differences, there are language barriers, and still, again, as a local product, we need to be building that trust.
We Care, the initiative itself, is really building upon the strengths of residents who are invested in learning how to better their health, better their lives, and to manage chronic illnesses, to better engage and more fully engage in applying strategies to improve healthy habits such as nutrition, and to get connected to important resources that exist here in our community to support your desire to age healthy in our community here in Howard County.
Specifically, we have people who are struggling with mental health issues. We have kids with special needs, and we have senior citizens who have been settling after they've already in the senior status, and they are facing transportation difficulties and of course cultural differences and language barriers, among other challenges.
We love that hospital. We love to go to the hospital. However, when it's not really necessary, we rather want to stay home. And this will give us that opportunity to find that out why we end up to be in hospital. And it's important for us to be a partner with the hospital, to be a trainee, to be a training ambassador. And I really appreciate those opportunities to be trained for community health and promoting our well-being in the community.
We're very much looking forward to participating in this initiative. This is a continuation of other initiatives which we have started here in Howard County, as well as other counties which have been quite successful. As a healthcare practitioner for over 30 years, along with our team, we recognize not just the cultural understanding that we need to have and exercise every day because of how, as Dr. Rossman mentioned, we receive information differently and have different feelings towards healthcare, but also being able to recognize, in our case, the role the medications tend to play. We all know it can be a blessing, and we all know what else medications can do. So the initiatives where we had really reinforces what we heard here, and it's proven to be quite successful, and I have no doubt it will be in this case as well.
I've been working here for the last 10 years in various capacities with the population of the Cradle Rock, and I can only say this is the best initiative that could have happened for the residents, the Russian-speaking population of the Cradle Rock. Thank you very much. We're off to a great start, great success to all of us. Thank you.
I've been a resident of this building for 8 years. And it's a great place to live. It's been wonderful. Howard County is wonderful, thanks to all the people who care about us. Currently, a group of us here at Parkview are meeting in a 6-week session entitled Living a Healthy Life with Chronic Conditions. Now, when you get a diagnosis of a chronic condition, you begin to want to learn about that condition. And you want to try to figure out how you're going to live with that condition. Some of us live with more than one condition. So the beauty of this program right now is that we come together in this, our community living room. This is where we gather with 2 wonderful young ladies, 2 facilitators, and we study this book. And we talk about how, although we have different chronic conditions, the effects and the consequences are often the same. Quality of life issues. So we brainstorm and we make lists and we talk about the feelings that you have as a result of living with a chronic condition. You can get depressed. We give each other support and we learn from each other. We teach each other the strategies that we use when we don't feel well. If you have chronic pain, how do you distract yourself? How do you work with the side effects of your medications, which sometimes can be nearly as traumatic as the condition or the disease you're dealing with? So we study this, we learn together, we support each other. It's really quite special. Next week, a number of us have already signed up for a program called Stepping Up Your Nutrition. This will take place in our neighbor building across the street. We've already got a number of people signed up for that. So, my mom used to say, getting old isn't for sissies. She said some other things, but I can't repeat them. So for myself, the residents here at Parkview, all of the senior citizens of Howard County, Thank you for bringing these programs to us. We do appreciate it. We appreciate the commitment of money and resources. Look at all these people we have to help us.